Hello everyone, it's Anastasia here. Today we are going to deal with a new as well as a very informative topic which is known as illness and illness behavior. I'm sure by now you guys might have been familiar with what illness means. We've dealt with this in the first topic where I've told you guys about the definition of illness and how can one assume that he is ill. So here we are going to learn in depth about what illness is as well as what are the behavior of a person when he or she is ill. So before we move on to the topic, let us first again recall what health and disease means. So health. According to the WHO, health is defined as a state of complete physical, mental, social, spiritual, and emotional well-being and not merely absence of disease or infirmity. So as I've said, a person is considered healthy only if he is physically fit, mentally stable, socially active, as well as spiritually healthy. So, in order to be healthy, all of these must be maintained. Disease is just the opposite of what health means. So, if a person is suffering from any disease, will be deviating from the normal function or the state of complex physical, mental, social, and spiritual well being. It is very simple, right? When one is suffering from any disease, he will not be mentally stable, he will not be physically fit, as well as he will not be socially active. Here, disease can be classified into 6 types. That is, the first one is the disease of biological origin. The second one is the social disease. The third is the deficiency diseases. The fourth is the genetic and congenital diseases. The fifth is the degenerative diseases and aging, whereas the last is the mental disorders. So here we have all know what a disease is. Now we are going to look about what are these different groups that the disease had classified. The first one, which is the disease of biological origin. This is nothing but the diseases which is caused because of the microorganisms that had penetrated or entered inside the body of an individual. These microorganisms can be the bacteria, viruses, protozoa, as well as parasites. The diseases which are caused by these microorganisms are commonly known as infectious disease. These diseases can be transmitted from one person to the other through various modes. That's why these diseases which is caused by these microorganisms are also known as communicable disease. For example, tuberculosis is caused by a bacteria known as Mycobacterium tuberculi, whereas cholera is caused by Vibrio cholerae. So here, there are different microorganisms which can lead to different disease. These microorganisms can either be bacteria, fungi, protozoa, parasites. So these microorganisms will penetrate into the body or will enter into the body of the individual and cause them to suffer from various kinds of diseases. Moving on to the second group, which is the social diseases. This group or this social disease is also known as human-induced disease because here the disease are being introduced into the body of an individual by the activities which is performed either by individual or the society as a whole. As well as the modern industrialized societies are particularly associated with diseases such as alcoholism, drug abuse, coronary heart disease, lung cancer, accidents, and various other pollutions that can lead to respiratory diseases. So, what does a social disease means? Here it means the diseases which is caused to the particular individual because of the activities which he or the society as a whole choose to perform. If the person is not maintaining any lifestyle modification, or if he is not bringing about any changes in the environment which he is living, this can lead to various kinds of disorders or diseases. For example, if a person has the habit of smoking, he is at high risk of developing lung cancer or any cardiovascular diseases. So, in order to maintain his health status, he or she should adopt to various ways that would help them to lead a healthy life. The third is the deficiency diseases. These diseases are caused due to less intake or absence of certain kinds of nutrients in the diet of the individual which they follow in their day-to-day life. These deficiency of nutrients in the diet can lead them to suffer from various kinds of diseases. Absence of protein in the diet can lead them to suffer from kwashiorkor or marasmus, as well as absence of vitamin B1, C, and D can lead them to suffer from conditions such as pellagra, scurvy, and rickettsia. So therefore, it is very important that when we plan our diet, we should be very careful to include all the nutrients which is essential for our body in order to prevent ourselves or our loved one to suffer from various kinds of deficiency diseases. The next one is the genetic and congenital disease. Here, from the name itself, we can understand what these diseases are all about. Genetic means something which we will be inheriting, whereas congenital means something which will be present in us before birth. So, these genetic and congenital diseases are nothing but the disease which are present in an individual before birth. Here, we can also see that many of the genetic disorders are also congenital. For example, Down syndrome, cystic fibrosis, as well as hemophilia. These are the common genetic diseases which can occur in an individual. Next is the degenerative diseases and aging. As we all know that degeneration of the body tissues can also lead to diseases. Here, as the person is getting old, many tissues degenerate and can cause to either partly or fully loss of their function. So here, because of these degenerative tissues, it can lead the person to suffer from various kinds of diseases. For example, it is very common for an old person to lose his eyesight as his age is increasing. Why? This is because there will be weakening of the eye muscles, which will lead him to suffer from visualizing, especially any material which is kept far from them. Other examples can also be arthritis as well as arteriosclerosis. So, as the person is aging, there are various diseases that he can suffer from because of these degeneration tissues or muscles in their body. Coming to the last group, that is the mental disorder, this will include all the conditions that would affect the mental status of an individual. It can include large group of diseases which can range from anxiety and depression to schizophrenia and madness. So these are the six groups that has been classified by diseases. The first one, which is the disease of biological origin. The second one is the social diseases. The third, which is the deficiency diseases. The fourth, which is the genetic and congenital diseases. The fifth is the degenerative diseases and aging. And the last, which is the mental disorders. So these are the six groups. Now we will also see that the disease is again classified into two major groups. that is the infectious or communicable disease, and the non-infectious or the non-communicable disease. Infectious or communicable disease. Here, the disease of biological origin will fall in this category. Why? Because these are the diseases which is caused due to the microorganisms. The microorganisms can be the bacteria, protozoa, fungi, or the pathogens that will penetrate into the body in order to cause the person to suffer from various kinds of diseases. These diseases can be transmitted from one person to the other. That is why this infectious disease is also known as communicable disease. These diseases can transmit from one person to the other either directly or through indirect methods. The pathogenic microorganisms may be transmitted by food, water, droplet infection, bite, or certain arthropods or other animals. So, they may be transmitted by direct contact or by sharing the contaminated objects with an infected person. On the basis of mode of transmission, infectious diseases are subgrouped into the following. There are certain diseases that can be transmitted through water, for example, cholera and typhoid, whereas there are some diseases that can be transmitted through air, that is, tuberculosis and influenza. Whereas we can also see that there are some diseases that is transmitted by direct contact, for example, AIDS and hepatitis. There are also some diseases that can be transmitted from the arthropods, for example, malaria and Kala Azar. And also, there are some diseases that can be transmitted through the animals, such as rabies. So, here, as I've said, these infectious diseases are the ones that can be transmitted from an infected person to a healthy person. That is why this is known as communicable disease. These diseases can be transmitted either through water, direct contact, through arthropods, as well as through animals. Whereas the non infectious diseases are the diseases which cannot be transmitted from one person to the other through those modes which we have discussed in the infectious disease. Here, the social diseases, the degenerative diseases, deficiency diseases, as well as the genetic or congenital diseases falls under this category. These diseases are non-transferable, which means they cannot be transmitted from one person to the other. Why? Because here no infectious agents are involved. Rather, various factors are responsible for the development of diseases. Example of these non-infectious or non-communicable diseases can be cancer. So this was about disease. Now let's move on to illness. So here, as we all know, illness is a personal experience of being unhealthy. It is a highly personal state in which the person's physical, mental, social, spiritual, and developmental functioning is thought to be diminished. Here we also see that illness is usually associated with disease. However, it can also occur independently. So, illness is a subjective state of a person who feels aware that he or she is not well. Here, it is just the opposite of health. It goes through a certain stage which can occur slowly and are highly individualized. The main stages of illness are transition from health to illness. The second is the acceptance of illness, and the third is the convalescence. So now let's look in detail about what this is. The first stage is the transition from health to illness. So what is this? This is the stage which starts when a person starts getting or starts experiencing that he or she is not well. And this stage will end with the acknowledgement of the other person that he or she is ill. Here, illness may begin with a very vague or a non-specific symptom, and here the person will first attempt to deny that he or she is ill. So here, after the person feels that he or she is unwell, and after he has got the acknowledgement of the others that he or she is seriously not looking healthy, what is the next step? First, he will try to deny that he or she is ill. Then, when the symptoms persist, he will start to seek for medical attention. Here, the symptoms that this person may be experiencing can be pain, fever, rashes, indigestion, loss of energy, stamina, or weakness. So, here the person may be experiencing these symptoms but still will not accept that he or she is not well. Moving on to the second stage, which is the acceptance of illness. This stage occurs when a person stops denying that he or she is not well and take on the sick role. This stage may be a tie of considerable psychological as well as physiological dependence when the ill person becomes unusually focused on oneself. So, what happens here is this is a stage where the person will start accepting that he or she is not well and will take on the sick role. In this stage, you will also find that this person will start seeking for physiological as well as psychological help. He will start depending on others to perform his activities, and he will also not fulfill his roles and responsibilities because of his health condition. Here, the person will define himself as being sick. He will seek validation of this experience from others. He will also gift up his normal activities and he will start taking up the sick role. He will accept diagnosis and he will also follow the treatment. The last stage is the convalescence. Here, as the convalescence takes place, a person will pass through a transition from being ill to a healthy person. So, this stage is nothing but when the person is feeling that he or she is regaining his health, he or she will start taking up his roles and responsibilities, as well as he or she will start resuming all his daily activities by himself without depending it on others. He will start feeling a new sense of worth and his anxiety will also be reduced, which will enable him or her to again lead a normal life. So, what are the tasks of the convalescence? During the period of convalescence, there is a great need of psychological adjustment. Following are the tasks which needs to be completed in order to return back to the previous state. The first one is the reassessment of the life meaning. The second is the reintegration of the body image. And the third is the resolution of the role change. We will also find that there are many ways to classify disease and illness. Here, an acute illness is typically characterized by severe symptoms but which will be present only for a short duration of time. Whereas chronic illness can be characterized by severe symptoms which will also last for a long duration, which can be for a period of 6 months or longer and often for the person's lifetime. So, in order to prevent these diseases and illness, there are several approaches which we can follow in order to maintain health. The first one is by making various lifestyle modification in order to improve health. The second one is by adopting to various methods in which we can protect health. And the third one is by following the various preventive measures in order to prevent ourselves from suffering from any kind of diseases. So Suchman has given the 5 stages of illness. Stage 1 is the symptoms experience. Stage 2 is the assumption of sick role confirmation from families and society. The stage 3 is the medical care contact. The stage 4 is the dependent client roles. And the last stage is the recovery or rehabilitation. So now let's study about what happens in the first stage, which is the symptoms experience. So here what happens is that the person will be aware that he or she is experiencing something wrong. When a person starts to develop illness, he or she will be suffering from many kinds of symptoms whereby he or she will understand that there's something wrong with his body, which would lead to physical limitation whereby he or she will not be able to perform his daily activities or his daily routine. And this can lead him to suffer from many emotional problems. These symptoms act as a signal that the illness has begun. So it is very important for a person to be able to distinguish symptoms from signs. And then if the problem is identified, home remedies may be used or certain other medications can be used in order to prevent these symptoms from persisting. The stage 2, which is the assumption of sick role. So here, if the symptoms persist or become severe, the client will assume the sick role. As we have all seen that once a person is sick, it becomes a social issue. Here, what happens is that the person will start seeking for confirmation from his family members or from his social group that he is indeed ill. So, because of this, he would also expect them to excuse him from his normal duties and role expectations. It is very normal that if a person is not healthy, we could not expect that person to perform his roles and responsibilities or to carry on his daily activities as he usually do when he or she is healthy. He would be advised to take a proper rest and to not perform any of the activities which he may wish to. This can lead to various emotional changes that can occur to a person, such as depression. So, here in this stage, it simply means that if the symptoms persist or it becomes severe, the person will start taking the sick role. Here, he or she will be expected that he or she must be excused from the normal activities or his roles and responsibilities because he or she is unwell and will not be able to perform them efficiently. So, moving on to the third stage, which is the medical care contact. Here, what happens is that once the person had assumed the sick role, he or she will start seeking the help of the medical services when the home remedies does not work. It is very common, right, that whenever we are feeling unwell, the first thing we will do is we will try to take some home remedies or prescribe medication by ourselves in order to cure from the diseases. However, if a person feels that these home remedies or these drugs which are self prescribed is not doing them any help, they will start to seek the medical health services. Here, the professional health care providers will validate his illness and will start formulating the plan which needs to be followed in order to provide the appropriate treatment for the person. So as soon as the person had seek the help of the medical professionals, he or she will be dependent on those professionals for the relief of symptoms. So they would start to accept care, sympathy, and protection from the stresses of life. After the person had followed the treatment regimen which was provided by the healthcare professionals and feel that he or she is gaining his normal health status, he or she will start to give up dependency and gradually return to their normal roles and functioning. They will start to assume their duties and other societal responsibilities. Once he or she has fully completed their medication, they would once again go to the clinical health settings for follow up in order to confirm that they have recovered from the particular illness or disease. So, this stage is known as the recovery and the rehabilitation stage. So, we have studied about the five stages of illness. The first one, which is the symptoms experience, whereby a person will start experiencing symptoms which will give him a hint that he is not well. However, he or she will deny that they are unwell. The second one is the assumption of sick role. This is a stage where the person will start to assume the sick role. They will start to accept that they are not feeling well, and they will also seek for confirmation of this from their families or the society. Here, they will also take up some home remedies or self prescribed medications in order to return back to their normal health status. If this fails, they would reach to the third stage, which is the medical care contact, whereby they would take the help of the medical professionals in order to provide them care and treatment. And the fifth stage is the stage whereby a person will be feeling healthy and will resume back to their normal activities, whereby he will be taking on his roles and responsibilities. So, those are the five stages of illness, which is very important, which was given by Suchman. However, there are also the other 11 stages of illnesses that was given by IGUN. The first one is the symptoms experience, whereby a person will be experiencing symptoms that he or she is unwell. The second is the self treatment, whereby he or she will start taking home remedies or self prescribed medications. The third is the communication significant with others, whereby he or she will start taking confirmation from their families and societies that he or she is unwell. The fourth is the assessment of symptoms, whereby the particular individual will be going to the healthcare settings in order to confirm whether he or she is really suffering from any kinds of symptoms that could lead them to various kinds of diseases. The fifth is the assumption of sick. So, here, as soon as they have visited the professionals, and once the professional had validated that he or she is unwell, they will start to assume the sick role. The seven is the expression of concern. Here, what happens is, as they have already assumed the sick role, they will start to express their concern of what they feel and what they want in order to assume their normal life again. The seventh is the assessment of probable efficacy or treatment or appropriateness of treatment sources. So here it's nothing but the person will start following the treatment in order to attain their normal health status. So, eighth is the one whereby the individual as well as the professionals would decide which treatment to follow for the betterment of the person. The nine is the implementation of treatment. Here, what happens once the treatment has been discussed and once they have decided that they will be following this treatment, they will start to implement it on the person in order to help him attain his normal life. And the 10 is the evaluation of the effects of the treatment. So what happens is once they have decided and once they have planned and followed the treatment, they will be evaluating in order to get an idea whether the treatment was effective or not. And the 11 is the recovery or rehabilitation. Once the treatment has proved to be effective, the person will start to regain back his normal health status and he will start to perform his daily activities and to take up his roles and responsibilities as he normally do. So we have come to the end of this topic where we have discussed about health, disease, the six categories of diseases, illness, the five stages of illness which was given by Suchman, and the 11 stages of illness which was given by IGUN. I hope you guys have got a clear idea of this topic. If not, kindly replay the video and try to listen to it once again. I'll be meeting you guys in the next session where we'll be discussing more about this particular topic. So till then, have a good day. Bye.